Now let's head to Central Africa, where essential medical care has been out of the reach for many pregnant women and newborn babies following decades of instability and armed violence. Maternal and neonatal health is a significant health emergency in the Central African Republic, with the country's maternal and child mortality rates among the highest in the world. According to the most recent statistics, women are 138 times more likely to die of pregnancy and delivery complications than in the EU. At the same time, babies are 25 times more likely to die before their first birthday if they had been born in Europe. Now, the country has 15 gynecologists for 6 million inhabitants. MSF teams in that country have been helping and tackling these everyday emergency as a priority. Now, to speak more on this, Adelheid Shaker, MSF Belgium Medical Coordinator, joins me. And good to see you, and thanks for your time and for all you're doing with your team. We understand the healthcare system in Central Africa is dire, especially for pregnant women who are finding it difficult to get much needed care during pregnancy. What can you tell us about this and the country where you are?
You introduced it well. When in Central Africa we talk about maternal and neonatal health, it's an emergency, it's a health emergency. So the country's maternal and child mortality rate is among the highest in the world. So, and on top of that, the decades of instability and armed violence have contributed to essential medical care being out of reach for many pregnant women and newborn baby. So too many dies every day for reasons that are easily preventable. So if healthcare was available, either in terms of pregnancy support and family planning, this can be easily preventable. So this is the general global situation in CAR.
Oshiaka, and tell us the work you and your team have been doing to help mitigate the effect of these well-known problems.
So our teams, despite the challenging security situation in some areas, so tackling this everyday emergency, saving as more pregnant women lives as possible is our priority. So for years, MSF provides free emergency pregnant women care and newborns in locations across the country. We train the Ministry of Health staff, renovate and equip medical facilities so we can provide a good standard care. I can go in details about statistics if you have time, but yeah, we have been doing helping the Ministry of Health for the past years facing this health emergency. So where I am now in Bangui, the capital city of Central Africa, our teams have been carrying out a vast program of to support the authorities and in sexual and reproductive health, including emergency gynecology, obstetric, neonatal care. Recently, in July 2022, MSF finalized the full rehabilitation of one of the biggest and largest health facility in Bangui. And the focus is maternal and child care. So our team do it in collaboration with those of the Ministry of Health.
And Shiaka, I know you're working, especially your team has been making good incursion in rural areas. If you don't mind, let us in on other health challenges being faced by people, specifically in Central Africa.
Yeah, in rural areas, people still die for preventable diseases. The access to primary health care remains very low. And this is mainly from security risk constraints, but also geographical constraints. So while real progress has been in terms of healthcare in some recent years, medical needs remains massive, and continuous support from donors is required to avoid many preventable deaths.
Well, Adelante Chiaka, I'd like to thank you for your time. Many thanks, as always.
Thank you. It was a pleasure.